Hey everyone, welcome back to the podcast. Today we're joined by Dr. Kyle Osbourne, a clinical psychologist, speaker, and mental health advocate. Thank you so much for being here, Kyle. How are you?
I'm doing well. Thank you for having me. I appreciate it.
Of course, I feel like your work is so important. So, Kyle, what led you down this career path? I know psychology is a lot of schooling, so there's a huge aspect of commitment to it, right?
Absolutely. There's a lot of schooling, a lot of lonely days in the books, a lot of papers. It's all worth it. I enjoy what I do in the work, working with folks. For me, what led me down this path was that I originally wanted to go into sports medicine. Like I'm a big sports person, and I wanted to kind of combine those worlds. I wanted to be like the team doctor or like the athletic trainer, working with like either professional or a collegiate team. And halfway through college, I experienced a couple of financial issues, not financial, family issues. Where unfortunately my mother passed away in the middle of like my junior year, and a couple other different things that come up. And while I was kind of like managing or kind of going through that situation, I didn't take school off. I just kind of kept going through. And I remember sitting here, I had a conversation with like one of my classmates, and unfortunately they had recently experienced a fire at their house, and they had lost all their belongings. Luckily, that person, no one was hurt, but they had like a huge loss. And so I remember sitting there thinking, like, well, how do people get through this? Like sometimes like we wouldn't have known unless we were like just sitting like in the library, just kind of hanging out one day, and it just, and I'm thinking like, well, how do people deal with this? How do people get through like some of these life stressors and some of these other different things that take place? And at that point in time, even just kind of me sharing my what I was going through with him helped to a certain extent. Outside of course talking to family, it was also like, hey, there are other people going through this also, and what, there was some relief that came from actually sharing with someone else. And so at that same time, I was also taking a couple of the my prerequisites. So I had taken like I had just finished up with psychology, and I was like, oh, psychology is pretty good. Like I actually did well in the class, and I think this is explains a lot. So I took a couple other different free elective courses that I had. I took like social psych, and I took like child development or child psych. And it made a lot of sense of what they were talking about, just of how children develop and some of the behaviors that we see out in society. Like it really all started to click. So, at that point, I was already kind of in my restricted science or bio elective. So it was too late for me to turn around without kind of doing a whole additional year or two. So I was just able to kind of finish out with enough credits to get like an unofficial minor in psychology. And I knew going forward that, what, this is the area that I want to go into. Like I want to be able to help people. I want to be able to, be that person that's able to try to help alleviate or help people manage getting through some of these life circumstances and stressors. So, and that's kind of after that, the rest is history. And I just kind of, and, indulge myself in all this higher schooling, which was really tough. But
Yeah, I love that story. That's beautiful. And it's true. I feel like we don't really get taught coping skills when we're growing up, right? So it's kind of like we learn how to cope through the experience itself. And I feel like a lot of people don't know until they go into the traumatic situations or go into the darkness how to deal with it before that. And psychology, what I love about it is it's really also showing us why people are the way that they are and allowing us to understand their upbringing. So do you feel like you have more compassion for people as well after learning so much about psychology and knowing that it's all very like stemming from a childhood place?
absolutely. I think for me, it has you look at a situation or even behavior through a different lens. So, for instance, there's something called the fundamental attribution error, where a lot of times what people will do when they see a behavior or they see a situation, most people are going to emphasize and place a lot of it on the dispositional characteristics of a person, right? They'll say, oh, this person is their character flaws, their personality, or it's a whatever's going on with that individual. Through schooling and kind of just being able to look at it through a different lens and actually working with people, you look at it like, okay, well, what's the situation that's contributing to what this person, what led to the act? Okay, how did this person get here? It's not like, oh, this person is just like an a-hole, there's this, that, and the third. No, it's like, okay, something else led to this point, like you said. So it could be something from childhood. It could have been something going on in their personal life. It could have been something going on in their relationship, right? It's a lot of different things that contribute to what we see, to like an overt behavior. So that's like the benefit of looking at it through that lens, as opposed to just kind of running and making like a snap judgment about someone or a situation that takes place, because you now are taking into consideration like other elements and factors of what's going on.
Right. I love that. It's so true, because I feel like it's so easy to judge everyone in this day and age, especially with social media. And, we're seeing all these people in the spotlight as well, too. And it's like, we're not really understanding like what's been the accumulation of like how they got to be the way that they are. So,
Absolutely.
Right. Right. And so for psychology and your practice, do you have a certain area that you specialize in?
So for me, I'm a big inpatient psychiatric person. So I work currently at an inpatient psychiatric hospital for the reason that I enjoy when you have, well, not want to say enjoy, but for me, when you have an individual that's in crisis, right? Whether it's a situation where they're experiencing, some sort of like a self-harming situation or suicide, or if a situation where you have someone that's experiencing, chronic persistent mental illness like schizophrenia or bipolar disorder with like psychotic features, or depression to the point where they're unable to actually function, or anxiety or what have you. Like that's the degree of, mental health that I enjoy or had took an interest in, for the reason that for me, it's very rewarding when you have an individual that may come into the hospital due to whatever that they're experiencing, right? Like we just talked about, a lot of different social components can contribute to where a person has gotten to where they are. Or it might have been something that they've been battling for a number of years, whether it's due to trauma, whether it's due to abuse, all these other different things. And when a person comes into the hospital and they're needing that intensive level of care, myself, along with, the psychiatrist, if the medication is needed, along with, we're doing individual therapy, we're doing group therapy, all these other different elements, along with like social work and like finding whether it's housing or other just different supportive resources that are needed. You get to now see that person maybe 2 or 3 weeks later, depending on what the circumstances were. Now you see them back to their baseline, right? Now you see them back to the thing where like, okay, you're starting to see typically how they are prior to the crisis taking place. And for me, that is one of the most rewarding elements of it, because now you get to see, and now you're kind of setting up the stage for them to do more work, say in the outpatient realm. So that for me was something that really, attracted me to like the inpatient realm, because one, you see such a variety of all these other just kind of different mental health issues. And then also you get to be a part of that team, or helping that person take them from that crisis back to their baseline, and then getting them ready to be back in the community and do more work. So I've also had a private practice, or participated in private practice and doing like outpatient work, which is great. Also, being able to work with someone on a more long-term circumstance, a long-term basis, which is great because you get to go along with, their journey and other different things that are going on in their life, as far as like work, relationships, and other different stressors that they deal with. But primarily for me, it's inpatient, like working in a hospital setting and being able to be a part of that team that really helps that person in crisis and get them back to an area or level of functioning where they're back to able to enjoy like being with their family and other different.
Oh, I'm sure it's so rewarding. And so when it comes to anxiety and depression, because I have a theory that like we're living in a time when most people, I don't know, I want to say maybe 80-90% of people struggle with some level of anxiety and depression. Do you have any sort of understanding of like why it's on the rise, or why you feel like so many people struggle with this?
It's for me, I mean, stress is at an all-time high.
Yeah.
I mean, like stress levels are so high, and there's been such a huge increase in anxiety prevalence over the past 20 years. I want to say like for generalized anxiety disorder is maybe about 6.8 million people that suffer from it. social anxiety disorder is maybe about 12 million people, I think, that have been formally diagnosed. Social phobia is, it's really just taking such a huge increase. I mean, COVID has its own little subcategory where it contributed to about a 25% prevalence increase.
Wow.
But just by itself. At the same time, it's just that stress is so high and anxiety is like a reaction from stress.
Hmm.
So when you have such high stress levels and you have situations like you mentioned earlier, you talked about social media exposure. So you have that, and you have that component where people are getting exposed to all types of content and things that they wouldn't have gotten exposed to or that they weren't getting exposed to, say, 20 years ago.
Hmm.
The economy and the financial, I mean, inflation we're talking about, right? Like if you go to the market, paying for milk or paying for eggs or paying for bread is like almost twice what it was even 2 or 3 years ago. And then you're talking about, depending on whatever area that you may work in, there might be some instability regarding the workforce. And then you're talking about people coming out with student loans. So you have all these other different things. You have relationships, right? Relationships are very stressful. Work,
Yep.
right? And all different avenues. So people are trying to navigate that. I think also people are living alone more than they were about 60 years ago. So you have that. Yeah. So you have that component. Just the social comparison, right? You have the social comparison aspect of people are measuring themselves by, a certain age, I need to have this, that, and the third, or I need to be making this amount, or I'm supposed to have kids by this particular age.
Yes.
Asking, right?
Yep.
And then combining that with social media, it's the social comparison part where you're looking at your coworkers or you're looking for other people like in your peer group and you see what they're doing and all these other different things. So you can't help but start comparing yourself. And then, a lot of all those different things start to overlap. Then you have medical issues. So people are getting sick more frequently, unfortunately. There are a lot more medical ailments that are taking place. And, if your medical issues are on the rise or high, like you're absolutely going to be totally concerned about it. Your anxiety levels are going to be, also, that's going to be at the forefront. So just because of all of these other different components are taking place in like any given person's life at any given time, you're going to be excessively worrying about that. And that's the thing with anxiety, is that a lot of times we're catastrophized, right? Our minds tend to go to the exact worst. Even if it's not like, even if it's not like the real, that's not rational, that's not like the most likely or probable thing that's going to happen in the situation, but that's just where our minds go.
Yeah.
So now it's like, how am I going to manage this worst case scenario where this is going to happen? Our minds just go down this really dark rabbit hole, and our anxiety levels are just through the roof with all of those things. So it's like a lot of overlap of everything that takes place.
I know, it's crazy. I feel like it's a lot of factors at once. And I feel like too, because I always struggled with anxiety my whole life, but what helped me a lot was understanding what anxiety was. Because I feel like when we feel it, we're like, what it feels like, this overwhelming sensation. And I think when you understand where it's stemming from or just what anxiety is in general, it really helps us get to a place where we can understand. Oh.
Sorry about that. That was my dog.
No, you're good. You're good. We love dogs.
The best.
Love it. He's welcome on the podcast. So I think like understanding anxiety helps alleviate it a little bit, because I think a lot of people don't know what it is. They're like, why is my chest feeling weird? And I've had people tell me, because I do healing work, more metaphysical kind of Reiki and energy healing stuff, but I have people a lot tell me like they never knew what it was. It just feels like this overwhelming sensation in their body, and it's it's like I feel like understanding what it is helps you kind of understand the processing of it as well too.
Oh, absolutely. I mean, you hit it right there on the head, where we have that physiological component or reaction to our anxiety. It's like it's a big, huge cycle where you're going to be experiencing it, okay, psychologically, in the way you're interpreting it, like you said, where you're just overwhelmed with things, and then your body absolutely is going to have a reaction to it. And then emotionally, there's going to be a reaction to it. And then,
Mhm.
your behavior is also going to be affected by that. And it becomes like this vicious cycle.
Mhm.
And the more you know about, okay, what does your anxiety tend to look like? Okay, then that's going to be the situation where, okay, all right, I know what's happening, right? Like you said, whether it's like the trouble breathing, or it's like the stomach issues, or it's other different things start to take place, like your appetite or weight loss or
Mhm.
all these other different elements. The more aware, just like you were saying, you become of it, okay, now you're in a better position to management, right? The more education that you're getting about it, then you're in a better place to manage that anxiety, because you know more, primarily what your stress and anxiety looks like.
Exactly. And do you have some tips for people out there who deal with a lot of anxiety, like breathing techniques, or what do you kind of recommend for people?
Breathing techniques are absolutely very helpful, especially with the mindfulness aspect of it attached
Mhm.
to it. What I would say is, with breathing techniques or diaphragmatic breathing, it's a situation where you really need to practice it. Okay, so it's a
Yes.
situation where I think a mistake that some people make is that you're only doing it when you become anxious or when you become
Mm,
overwhelmed. And at that point in time, it's going to be ineffective, or it's going to be that much more difficult to do,
mhm.
just for the reason that it's so forced. So
Yeah.
it's getting in the habit and practicing even when things are going okay, right? Because
Mm,
the easiest thing is for us to do is breathe, except for when we get overwhelmed. So that's when it's a situation of, okay, you know what? Let me practice it just when things are going well. Let me practice when in the morning, even as I'm just kind of sitting there watching TV,
mhm.
all these other different aspects. So that's what, now at least it's more fluid, it's more genuine when you do need to participate in the diaphragmatic breathing when you become overwhelmed or when a stressor takes place. Then it's like, okay, now it can become more useful because it's not so forced, and it's not,
Mm,
you're kind of fighting against it.
yeah.
And then also just having those conversations with yourself, right? Actually challenging some of those negative thoughts, right? So when you said, when a situation pops up and we immediately go to that worst case scenario, it's kind of, okay, let me ask myself some of these questions. Okay, how likely is this? What's the evidence that supports this? All these other going, having that conversation with yourself kind of allows you to kind of bring yourself down to a managing level where it's like, okay, all right, my anxiety or my stress, it's starting to get the best of me, and I'm starting to spiral. You kind of bring yourself down when you have that awareness about it. So, um, having those inner dialogue and having those conversations with yourself has proven to be really helpful for a lot of my clients. Just, and along with the mindfulness and the deep breathing with the physical aspect also has been helpful.
Yeah, it's so helpful. I feel like the talking yourself down, because it's like with anxiety, you're like 10 steps ahead and you're like, wait, I haven't even left the house yet. And I'm thinking about all the things that could go wrong. I feel like I'm still in the house, you know? So it's kind of crazy. Um,
Good.
and one thing I really did want to go into with you, Kyle, is talking about relationships in this modern world and some red versus green flags, because that's a big one that listeners wanted to get into, because I do feel like the younger generations now are more aware of red flags and unhealthy relationships, where we grew up seeing a lot of very toxic dynamics. And I think now people are kind of like aware that that's not really going to work anymore so much.
Mhm. Yeah, I mean, with the red flags, I make it's similar to me as far as like your warning signals or your indicators, right? It's a situation of, they're the characteristics or behaviors that tend to take place during the course of a relationship, or that are being displayed during a relationship, that could be harmful to you, either physically, emotionally, or psychologically. I
Mhm.
always, I equate it to when you're driving a car. How do you know that the car is getting ready to run out of gas, or if you need to get oil, or if your car needs maintenance?
Mhm.
An indicator light's going to come on, right? That's the way that you know something's wrong. It's letting you know, okay, you know, 50 or 60 miles out, you're going to run out of gas. So it's letting you know, that's your indicator. It's the same way in our relationships. Typically, you'll see some little nuances, right? It might be infrequent depending on the situation or the person, but you'll see some indicators that'll come on every now and then.
Mhm.
So it's remaining aware and being like, okay, well, because if you don't address some of those indicators or some of those warnings or some of those behaviors that take place now, later on down the road in the relationship, that's where they can become harmful. right? That's where they really have that severe impact, not only in your relationship, but in other different aspects of your life. And so, that's where you want to, like you mentioned earlier, just kind of becoming more aware of what are your particular red flags, because everyone has a different set of red flags.
It's
Everyone has
true.
a different criteria. So it's really important for you to understand and start to know, okay, what are yours, right? And
Mhm.
what are some of the things that, you really want to be on the lookout, so it doesn't get to a point where it becomes so overwhelming or really detrimental down the road.
Mhm. Yeah, and do you feel like a lot of people now do have that awareness more so? Because I just feel like it wasn't really talked about back in the day. Like, we never heard about red flags or anything like that so much.
I think some of the information is getting out, which is good.
Mm,
Um,
okay.
I think it's absolutely, you want to go into a relationship kind of with some awareness, right? You want to be vigilant to things that maybe didn't work previously, or maybe things that you've seen in other people's relationships, or whatever the case may be. I think before, there was like this sentiment where people just kind of went into relationships like with, no kind of criteria, just kind of no intentions. Let's just see where it goes.
Yeah.
And if you're kind of going in there, you're kind of just letting things kind of pass off, or you're maybe minimizing things, or you're just kind of like, ho hum kind of about stuff. Where now it's good that some people are recognizing, okay, these, this popped up, right? Whether it might be a lack of communication, or it might be like controlling behavior, or it might be other different behaviors that pop up. And it's like, hey, you know what? Like that that could be a problem later on if we don't address it, right? It's like
Yeah.
I'm starting to see that's happening more frequently. So it's good that the discussions are taking place, because if discussions are taking place, now people will be more vigilant to it. And so, absolutely, you want to go into a relationship, hopefully, and you have, okay, these are my red flags. These are some things that I'm going to be on the lookout for, or something that I noticed, maybe my partner or whoever I'm dating. I noticed that they did this behavior, this came up,
Mhm.
and that really didn't sit too comfortable with me, and I don't want it to go too further, happen too much more frequently, because then it turns into something that might be out of control. So I am happy, absolutely, that the discussions are taking place more frequently.
Yeah, do you feel like when you get into trouble is when it kind of starts piling up and someone's like, "We never addressed it in the first place," and now it's just this huge, overwhelming pile of red flags?
Yeah, totally. I think the
Yeah.
people get in the habit of collecting the red flags,
Mm,
right?
mhm,
So now, and that's the whole situation where it's plural, right? As opposed to just saying, okay, maybe it was just kind of one issue or one trait that was a problem.
mhm.
Now it turns into, oh, well, it's controlling behavior. And then the person doesn't communicate, when the person is always threatening to leave. And so you have a whole collection of red flags. And it's similar to like your car. Like if you're driving your car and the gas light comes on, so you didn't get any gas, and then the oil light comes on. And so, you're running low on oil, and then the air pressure on your tire, you know, pretty
Yeah.
soon you're going to be on the side of the
Yeah.
road.
Yeah, yeah,
Right.
it's not gonna be good, it's not gonna be good.
Right. So it's like, if you don't go get the gas, if you don't go get some air in your tire, if you don't go get the maintenance done on, you know, you want to address these things when they're telling you ahead of time before it disables your vehicle. So you want to do the same thing in your relationships, that you want to address some of these situations, or you want to address some of these issues before it gets to a point where it does become more severe.
Right, and so with the whole mental health stuff as well too, do you think a lot of people, unhealthy relationship dynamics really do come into their anxiety and their depression and what they're dealing with because they're just in these situations that they feel kinda stuck in a lot of times as well too?
Absolutely. A lot of times, and you mentioned childhood
Mhm.
earlier in our conversation, where sometimes it's difficult to spot red flags or these type of behaviors, because it almost mimics the behavior that they had or that they experienced when they were
Yep.
in childhood, right? So
Yep.
you were in a situation where there was always yelling, maybe in your household, right? There was
Yep.
always that type of, and so now you're in a relationship where someone is always yelling, constantly screaming. It's
Yep.
difficult for you to say, hey, well, this is unhealthy. This
Yep.
is an issue, for the reason that it's something that you found acceptable, or you're something that you were used to,
Mhm.
or a child, or something that was kind of part of your environment. So it could become even more difficult to recognize something when it's been a part of your life in kind of other different avenues, especially during childhood.
Yeah, something I think about is like it's sometimes it might not be good to look for someone that feels like home because what if your home was toxic or disruptive, right? And so I think it's interesting. It's like sometimes we're like, oh, this person feels like home or they feel familiar, comfortable. And it's like, but is that always a good thing? Because maybe that upbringing, the home wasn't a healthy home to look for. And I think it's hard to get out of those cycles and dynamics as well, too, because it's just so familiar to you.
It is, and people will tend to, or most people will tend to fall back on what's comfortable for
Yeah.
the reason that you're not challenging yourself, right? You're not stepping out of your comfort zone.
Mm.
And that's a part of any healthy relationship is, becoming a little bit more uncomfortable, trying different things, stepping out of that comfort area or that box. However, like you said, if you're used to a certain type of dynamic, you're used to a certain type of conversation style or love language or all these other different things, even though they haven't worked in the past or they've been like in a smaller duration, it's still like, okay, well, I don't really have to challenge myself. So I'm just going to sit back, like you mentioned, into something that's more comfortable because this is what I'm used to. And
Mhm.
then that also takes and can affect when you finally do get into a healthy relationship.
Oh,
So
yeah.
it's like, hey, you know
Yeah.
what? I'm not used to this. Like I'm used to, the ups and downs. I'm used to the
Yes.
unpredictability. I'm used to like the arguing with people.
Yep.
Finally, when you get into a relationship or a situation with someone who you get along with, you're not at each other's throats, and you're like, hey, this is
Kind of
this is
boring.
right, this is boring. Like this is what's going on here.
Yeah.
And you have to check yourself and have that conversation and say, well, hey, is this really wrong, or is it that I'm not used to being in a healthy situation?
Yeah, gosh, that's a huge one that I talk about a lot is just like finding those like boring relationships and they're usually the healthy ones, right? And it's like those like intense relationships where we feel the ups and downs and we're so addictive. I feel like the addictive quality is always a sign of toxicity in relationships.
Absolutely. People get used to that component, like the ups and downs and like the unpredictability, the impulsive. Like they associate, and a lot of it does overlap and is contributed by possibly childhood or previous relationships, whether it was their family, whether it was, other past, romantic relationships. They get used to that. And so
Yeah.
that's what they associate with love and care, right? It's like, oh, you only love comes in when we're at each other's throats. Like you only care if we're yelling at each other. And then you have someone else that's like, no, we can have a conversation.
Yeah. Yeah, and you're like, what is this?
Right. It's just like,
Yeah.
okay, it's so foreign to that person that they may actually say like, oh, they may label it boring, or they may label it like there's no energy or pizzazz to it. And
Mhm.
there's a big difference between, something actually being boring and being like, okay, well, we don't go anywhere as a couple. We just kind of stay in house. We don't just whole home. We don't do it. Okay, that might be appropriately kind of labeled boring because of just like where the relationship is. It's different than we're at each other's throats one minute and then we're cuddled up with each other the next minute.
Yeah. Yeah, right.
Right. And then you don't know where the relationship's gonna be.
Yes.
It's just gonna be up and down and where
Yep.
it's to and from, and you never know where the person's gonna be and all kinds of other
Yes,
different
God. Yeah.
right. But they associate that with love and care.
Right, right. And so would you say like in looking for a healthy relationship, look to something that feels stable and calm?
Absolutely. You
Yeah.
should absolutely be vigilant in the sense of, okay, what are some things that, um, one that I enjoy doing with someone else, right? Like, what are some of those things that are like, okay, I like a person to be, communication, like
Mhm.
someone to be open, someone to be honest, someone to be, have these other different intangibles. Like that's something you want to look for. And you should have, a criteria where it's like, hey, I'm not going to settle on that. Like you're not going to find, no one's going to check all the boxes.
No.
We know how that works, right? You're not going to find your perfect ideal person.
No.
You can get pretty close to. There are some things, especially when it comes to your emotional health, your physical health, and your psychological health, that you don't want to compromise on.
Mm.
Right? There's some things where it's just like, hey, I'm not gonna, stand for as far as someone being manipulative or all these other different things, and it's constantly throwing me out, right? Like if you're noticing you're not your authentic self when you're in a relationship, as opposed to when you were alone or when you were independent, when you were not in a relationship,
Mhm.
that's an issue, right? That's to me as a red flag. That's something where it's like, hey, you know what? I'm noticing like I want to be in this relationship, but I'm noticing I'm a little different from where I was. Like I'm finding myself compromising more often than not.
Mhm.
So it should be someone that, has some of those markers that you're not willing to compromise on. And that typically also, works out.
That's a good one. I feel like too, I have a question. So what is it in relationships? Because I feel like I've seen this a lot where the partner kind of pulls that person away from like their friends or their family.
Controlling behavior. I mean,
Mhm.
some individuals just divide and conquer for the
Mhm.
reason that one, it's probably worked in previous relationships, right?
Mhm.
It's like that's when they've been even able to um elicit more control when that person is kind of on an island on their own, when they're not getting
Yeah.
any type of outside feedback from like family or friends. Like they're way more easier to manipulate when I just have that person, when I am the only voice, that they have. A lot of times that can come from, either like some type of like rejection or abandonment issue that from that person. Because sometimes it's intentional, sometimes it's not intentional, right? Because we
Yeah.
always have to take in consideration, okay, why is this person kind of doing those behaviors? Is it a situation where they're trying to manipulate and have that control, or is it something that's how they've conducted themselves in previous relationships, and this is kind
Mhm.
of where they learned how to communicate? Where it's like, oh, why be that? But a lot of times, it's a divisive, behavior. Like if I can get this person and I have them all to myself, then now they have limited options.
Mhm.
And so now it's going to go the ways that I want it to go. It's going to go, they're going to kind of go, to my liking because they don't have the support. Like when you're cutting off people from their social support or from their family support,
Mhm.
now they don't have any resources, right?
Mhm.
Their confidence gets lower, their self-esteem gets lower. And that's, their intention where they want to be able to control that person and do it to whatever their liking is. So that happens a lot in
It
relationships.
does. It does. Yeah. I feel like it's also like you'll have friends and it's like they're in this relationship. Now you don't see them as much. And I just feel like it happens way more often than it should, a little bit too normalized. But another thing, too, a question I had for you was because I feel like on TikTok and social media, people talk a lot about gaslighting and it's becoming these terms that people might use a little bit too loosely. And so I wanted to know from a psychological perspective, do you feel like maybe sometimes these phrases get thrown around too much without people having the proper knowledge about it?
I do.
Yeah.
It's the gaslighting, even like the word trigger,
Yep. Trigger's a big one.
when that it just gets romanticized and
Yes.
utilized without the proper education and
Mm.
aspects. It gets used very loosely and thrown around, I think, way too frequently.
Yep.
Um, I think absolutely an education on that would might decrease it a little bit. I think sometimes when some of these terms get utilized and once they kind of gain momentum, there's no pulling it back.
It's just off.
It's off and running, and it's just like, I
Yeah.
when I hear certain terms, it's like, it makes me cringe. Where it's
I
like,
know. I'm sure as a
like,
as a psychologist, you're like, no, you don't understand it.
that's not right. What you try to do is try to provide a little aspect, a little education, and at least utilize it in its proper context. I mean, 'cause gaslighting is at the end of the day, it's manipulation.
Yeah.
That's pretty much really what it comes down to. Now there are varying, extents of it. However, but that's really what the framework or like the meaning is. But yeah, it's tough, like because you want to. Sometimes people will be open to that
Yeah.
education or really what gaslighting means and what the word trigger means and other different terms that have gotten romanticized and overutilized. And then some others are still just going to be like, hey, no, I'm using it in this way because
Yeah.
this is the buzzword of the
Yeah.
year. And
Yeah.
this is what I'm going to do. So the best you could try to do is, try to educate people, which is what, I like to use my TikTok forum for, is trying to give some information out about just kind of different aspects of mental health and different things. And because you never know really how that word is going to affect someone else. Like, you don't know someone else's history. You don't know what someone else has been through. And you don't know how a certain word is going to activate what they've been through, their experiences, their memories, or things of that nature. So, something that I've tried to do even with my clients, even especially when I work with, with adolescents, is that just keeping in mind other people. Like I get it. It's become a part of a lot of people's everyday vocabulary.
Which is crazy.
It's wild.
It's
Yeah.
wild. Oh my god. Oh, that's
It's wild.
crazy.
I don't even know how it got here, but
No.
it is just
Yeah.
trying to have people as much as possible just remain aware of things. I know when you go, but there are some other words that can be utilized, more appropriate words.
Yeah.
And it's like just try to be as mindful of other people in the room and kind of what those words and how they affect. Sometimes it works, sometimes it doesn't. But
Yeah. I feel like it's better to maybe be like, okay, people can be a little manipulative. It doesn't always mean they're gaslighting, doesn't always mean they're a narcissist, which is another thing too. Everyone wants to diagnose everyone now as a narcissist and everyone's bipolar. And it's like, it's too much. It's too much. It's crazy.
And a lot of times the words are so inaccurate. Like
so inaccurate. Yes.
Oh, like bipolar is one that's been historically misused in everyday conversation or pop culture. Oh, this person, they're bipolar because they're up and down. Like, well, that's not what bipolar means. Like it's opposite ends of locations of spectrum. But if you're talking about the diagnosis, that's nowhere near what bipolar disorder is. Same thing with narcissism. It's like, yeah, he's just like, that's not it. No,
yeah, maybe they're selfish, but they're not quite a narcissist, right?
Yeah, they're not. Yeah, type A personality. Also, oh man, that one gets me. It's like that's not a real thing. That I mean, type A personality originates from cardiac issues. Like it's like it's if people actually really did the reading about it, they would be shocked. Of how like they're using it in the wrong context. But it's tough. The best you can do is try to put the information out there and see, who hooks onto it. But it's tough.
It's tough. I know. It just gets thrown around. I feel like that's with all knowledge, though. It's like when knowledge gets in the wrong hands, it's just like at that point, what do you do?
Oh, totally.
So when you're in school for psychology, and how many years was that of schooling? I'm curious.
11 or 12 years in total.
Ooh.
Yes.
My goodness.
Yeah, it was rough.
Jeez, that's insane. I don't know how you did it. And psychology is like really hard. Like I took one psychology class in college and I was like, this is not what I thought it was going to be. I was like, I'm like failing this class. So I think too, people have a perception of psychology as going to be this like fun, we're going to analyze people. And it's like, this is like really, there's a lot of groundwork that goes into psychology, right?
I think it also depends on the professor. Like I know from my general psychology professor, I remember, was really cool. He made it very interesting. So I think that also is a big consideration or a big factor in regard, especially to like intro to psych or general psych, because he provided like real life examples. And I like remember because I think he had worked also in the field. He worked like inpatient. And so a lot of some of the things that that came up that we discussed in class, he gave an example for. So that made it a little bit more interesting.
That's so helpful. Yeah.
Like if you're talking about Pavlov's dogs, you're talking about conditioning, that can get pretty boring.
Yeah, it's very wordy, like the words, and it's very logical as well too. I thought it was gonna be like we're analyzing people. I'm like, this is all logic. Like it's all text and it's crazy.
And if you put it in terms of, okay, if you have a pet and you reduce this with your pet and this is how you condition them, because a lot of it is even when you're doing like when you train your dog, like if you take your dog to like PetSmart or Petco and you're training them, they are essentially doing conditioning work. That's all it is. Conditioning and reinforcement, conditioning stimulus, all these other different things. Everything that they talked about in general psych as far as like the Pavlov's dogs and salivating thing, they do it right there in PetSmart. So but if you give an example to like students and you put it where it's applicable to like their home life, oh yeah, my cat does that or my dog does that, I noticed that after I started doing it, then it's more enjoyable and a lot easier to digest.
Yeah, do you have any resources for people who are into psychology and kind of want to know like where is like a good resource for like reliable information about learning this stuff?
What I would say is absolutely as far as I'm trying to think.
I feel like there aren't as many resources as you would think, right?
Yeah, it's very like it depends on like how specific you want to get. So of course, if you're talking about different diagnoses, you have like our DSM-5 on that comes out like every few years as far as like the diagnosis and And they break that down into categories and things of that nature.
Yeah.
If you're talking about like group psychology, which is pretty cool. I love group psychology. It's a thing that even again we do a lot of in the inpatient world.
What
Uh,
is group psychology working with groups in therapy or what exactly? Okay.
That's exactly what it is. It's
Okay.
and the thing is with group therapy or group sessions, typically they're per like whatever specialty, right? Or per kind of diagnosis or per whatever symptoms that people are experiencing. So if it's you can have like an anxiety group, right? You can have people
Mm-hmm.
that are experiencing anxiety, or you can have like a trauma based group. You
Mm-hmm.
can have a group where it's like anger management, and you can have a situation where people are experiencing depression. And the good thing about that is that individuals tend to be more open, especially when they're around other people that have similar experiences. So if they're,
Yeah.
they come into a room and they're like, hey, you know what? Like, oh, you're going through this too. Like, oh,
Mhm.
you get like stomach pains and cramps when you get anxious about things. And,
Mhm.
now it's a lot more cohesive. Now you're not alone, like we talked about, kind of like just facing all of these different symptoms and these stressors by yourself. So that's why, that always interested me, because you have the component where the cohesion is starting to take place, where people are also learning from each other. Like, oh, well, hey, you know what? When I was in this situation, this was helpful for me, right?
Mhm. Yeah.
Because you have different kind of varying degrees of where the people are, or where they're at in group. So you have that cohesion going on. And then you also have someone like myself, like the facilitator, a clinician, who's
Mhm.
able to provide that information that we talked about, right? So now I can tell you and provide you information which is helpful in you managing your anxiety, or you managing your substance abuse, or you're managing your depression.
Mhm.
And so now, along with both of those aspects and components coming together, a lot more beneficial, because now
Right.
it's a very different thing. So
Right.
that's typically where what happens a lot of times. And you can have there's outpatient groups, which is
Mhm.
cool too, where you have people just from everywhere. They're doing it virtually now.
Okay.
Where you have a lot of different people. You can be in different states, different areas of the state, different areas of the city, but you're still coming together for that kind of common goal, and you're doing it together. So that's always a cool aspect, and that's kind of been the thing where I've tried to do kind of social media informally in regards to like TikTok, or just putting out the information. And even you'll see it like in comments where people will be like, oh, this is, you can see the conversation or the dialogue taking place. And that's the benefit of it, where it's like, okay, someone's getting the information. It's helpful somewhere.
Mhm.
So that's what the conversations are starting to take place. As far as like, it really just depends on, as far as different books of what area of psychology you're looking for, because
Okay.
it's good that it's universal and it branches off into different things.
Mhm.
But like if it's group, you have someone named like Yalom. If you're looking at, the cognitive behavioral therapy, where you're talking about like your thoughts, how they impact your emotions, and how your emotions then contribute to your behaviors. You
Mhm.
have like Beck. You have the Dr. Becks of the world, where those books are great in learning how to manage stress in those situations. So it really depends on kind of just what avenue of like psychology you're looking at.
That's a good point. I feel like too, I like what you said about the group stuff because I think a lot of times people feel really alone in these experiences with depression, anxiety, trauma, and then you look to the next person next to you and they've probably been through very, very similar experiences, right?
Totally. And it's just like, oh, and the thing about mental health is that there is no common face, right?
Mhm.
It doesn't discriminate. It doesn't,
Yeah.
doesn't care male, female, old, young, what your socioeconomic status is. It affects everyone. Like
Mhm.
everyone's going to lose somebody. So you may be in a room, you may be in a grief therapy group where you have someone who lost a family member very young, next to
Mhm.
someone who's an elderly person.
Yeah.
But the griefs are similar in the sense of possibly what they're experiencing and what was helpful in having those conversations and just having that communion and that companionship that they're able to develop.
Mhm.
So
I love
it's
that. Yeah.
group stuff is powerful. It's really cool stuff.
I love that you said that too, because I think sometimes people feel like their trauma isn't enough almost, or that their pain isn't enough. They haven't been through enough. So sometimes they don't seek help because of that as well too. And that's a really powerful thing to think about. So what would you say kind of final message for people out there who might be struggling with these things, anxiety, depression? Would you say the best thing to do is just talk about it, reach out to someone?
Yeah, absolutely. A lot of times we get stuck saying, when people ask you, how are you? You say, I'm cool. I'm
Yeah.
good.
Yeah.
Chilling. I'm
Yeah.
all right. And we get used to these stock answers that we provide.
Mm.
And it's like, people have said like, it's okay for you to say, yeah, I'm not doing too great. I'm not doing well. I mean, the problem I think that, we have gotten the notion or used to being strong, right? Especially depending on what your responsibilities are for people, whether you have kids or you're all these other different situations. We get
Yep.
used to being strong, right? We get used to putting on that facade or that face
Hmm.
strong for everybody,
Yep.
even though you're struggling. The
Hmm.
problem is that when you continue to put on that front that you're strong, is that people will believe it. So
Yeah.
people aren't going to ask you about it. People aren't going to
Yep.
ask you when you say you're okay. They're going to think you're okay.
Yep.
And even when I've had clients that say, "Well, what if I tell someone and I tell them that I'm not okay?" I'm
Mm.
like, okay, maybe they can help. Right? You
Yeah.
never know what someone else is going to be able to do unless you tell them what's going on.
Yep.
And that's been the biggest misconception for a lot of people of when they've gotten to a point where they have continued to try to take it on by themselves or they continue to ignore it. And unfortunately, it may result in a hospitalization because they've experienced a crisis because of just everything just built up and everything just collapsed. When they've been hospitalized, one of the common things that comes out of it is or revelations that they'll see all of their family come, right? For those of them that are fortunate to have support or friends will reach out when the word gets out that that person's in the hospital. They're getting phone calls. People are visiting them, and when I've had sessions with people, they're like, "Hey, I haven't talked to my cousin in like 7 months, but found out that I was in the
Yeah.
hospital and came and visited. He lives an hour away.
Mm.
I didn't know that they care. I didn't
Aw.
know that that they felt this way or that there was going to be this outreach of support." I said, yeah, we don't know because a lot of times we don't give people the opportunity to know.
Mm.
So it's like
Yeah.
sometimes if we reach out, if we say, hey, this is what I'm going through, this is what I'm going on, it's like, okay, we don't know what the other person or your family or your brother or your best friend or whoever that you have in your life, what support they might be able to provide. Right? They may know therapists or they may say, hey, you know what? I know a group or you know what, let's work on getting this done for you. Or, hey, I'm here with you. Talk to me about it. Right. All these other different possibilities that can take place.
Mhm.
But a lot of times we just get used to kind of just being closed off and kind of just dealing with it on our own.
Mhm.
And we're all guilty of it. Right. It's not a bad thing. We're all guilty of it because that's kind of like how society is conditioned us is that we just continue to go about it, lace up your boots and just kind of nobody wants to hear it. You don't want to be a burden to anyone. All these other different
Yeah.
right?
Yeah.
At the end of the day, we're doing ourselves a disservice. Like we
Mhm.
are the ones we're only harming more of ourselves and putting more and more of the weight on ourselves. So,
Mhm.
just getting out of the habit of, having that stock answer. And I get it, not information isn't for everybody. So I'm not saying going to
Yeah.
work and just tell everyone, hey,
Yeah.
I'm not saying that. But if it's someone you trust and someone that, a family member or a close friend, and they ask, hey man, what's going on? How are you? It's okay to say, hey, this is what's been going on with me.
Ugh, yeah. Yeah.
And that's where it starts.
That's where it starts. So it's basically just opening the space for those conversations to be had, correct?
Totally.
Ugh, I love that. That's a good one. Yeah. Society crazy right now with just people really holding on to so much. And so, Kyle, where can people find you for more of your work? I know you have a podcast as well, correct?
So I have, in addition to being on TikTok, at Dr. Cos, I also have a psychologist with my colleague and one of my best friends from school, Dr. Jason Coleman. We have the Black Psychologist podcast, and that's on all, streaming platforms and on YouTube. And we have discussions just similar to this. We talk about relationships, we talk about just kind of things that are going on in pop culture, especially as it pertains to the behavior component or the mental health component, because that's in everywhere you look, right? There's always a mental health aspect to things that are going on, whether it be
Yep.
politics, whether it be financial stuff, whether it just be parenting, relationships, all different things that are taking place. We absolutely read a lot of different articles. So if there's like different upcoming, things that are happening in the psychological world or just in the mental health space, like if there are, these new different unfortunate like drug trends that are coming out as far as like with like the
Yeah.
with various little small color candies and things like we talk about these things because it's really important that the community know about these things, right? It's really important that these discussions start to take place.
Mhm.
So yeah, absolutely. We just recently had a couple weeks ago a relationship oriented conversation about men that don't post their partner on social media.
That's a big one. That's a big one.
Yeah, so over a really deep discussion, we had our other colleague, Dr. Ashley Poole, who does practice with relationships and families, and we always love having her on because that's absolutely in her wheelhouse. So that episode came out a couple weeks ago, and in addition to that, I also have my partner and I. We just recently started a nonprofit called Cammy's Closet. That's KAMISCOLSET. It's Cammy's Closet Community Clothing Project. And that's something that we're really excited about. We provide free, brand new essential clothing to the homeless
Oh my
population.
gosh, that's amazing. That's amazing.
Yeah. So those that are homeless or that are in need of or experiencing financial constraints,
Mhm.
especially given just with COVID. Both of us have worked in various hospital settings, and we know that that has absolutely been an area that's been in need. In addition to the food that people need, it was like, okay, having that idea, what if we're able to provide free essential clothing? So you're talking about t-shirts, bras, socks, underwear, t-shirts, all these other different things to individuals, and they're it's new. Not to say that having clothing donations or things that are picked over are bad, because that's also necessary, but just kind of keeping in mind with COVID, we have to really keep in mind with just, with illness and infection.
Mhm.
So we thought that this would be a healthier alternative. So we had a clothing donation where we worked with one of the homeless shelters here in Philadelphia, and we were able to donate over 200 free brand new clothing items to the shelter, and it went really well. So we're gearing up to do another clothing donation with another transitional or nonprofit organization here in Philadelphia, hopefully sometime next month. So yeah, we're really excited about that.
Oh, that's amazing. I feel like homelessness, that's a whole other thing, but I feel like it's a topic that gets strangely ignored more than it should. So that's really beautiful and amazing that you're doing that. And I'll link all your stuff, your podcast as well. I feel like I saw some on YouTube. It looks like it's got a little following. well, well, thank you so much, Dr. Kyle Osbourne, for being here. I really appreciate your time. And I learned so much. I know the audience did as well. So thank you so much for being here today.
I appreciate you guys having me. All right. Anytime, let me know. I would love to come back.
Awesome. Thank you. And bye, guys.
Yeah.